Hello guys, welcome to another video of Elite Expertise YouTube channel. I'm Harika Bimavarapu, myself practicing as a consultant pharmacist in Australia. I work with Monash Health Hospital in Melbourne as a clinical pharmacist and clinical pharmacist education in Monash Health Hospital. Elite Expertise platform is an online training platform exclusively for pharmacists, which enables an overseas pharmacist to apply for general registration in Australia. We have courses ranging from KAPS, Australian Intern Written Exam, and Australian Intern Oral Exam to help you achieve your goal of becoming a fully registered, fully qualified pharmacist in Australia. KAPS is also called Knowledge Assessment of Pharmaceutical Sciences, which is conducted by Australian Pharmacy Council, enabling an overseas pharmacist to practice in Australia. It makes it one step closer for you towards achieving your general registration. So we have received the July 2023 KAPS result. For all those students trained by Light Expertise, we have received a massive record of 90% pass rate. And one of our students, is with us, who has cleared her KAPS exam in her very first attempt. Congratulations, Kanwar.
Thank you so much, ma'am. Thank you to you, ma'am. Thank you to Sir, Rekha, and everyone. Yeah.
You're welcome, dear. So how do you feel?
On cloud nine, ma'am. Yeah, I'm so happy, ma'am. This was a moment which I was waiting from many years, as I have completed my master's in pharmacy in 2015,
Okay.
and there was
Did
a
you
long
complete
gap.
your master's in Australia?
India, no, in
India.
India, ma'am.
Okay, yeah. So it
And
was
I came as a international student, and I studied something else. And I always dreamt of being a pharmacist in Australia. And yeah, I was working in a pharmacy as a pharmacy technician, but still I was lagging behind. Like they were always, whenever I go to the pharmacy, like always in my head, like when I'm gonna be the registered pharmacist.
yeah, it's
Yeah.
not satisfying to work as a technician when you're already a qualified pharmacist. Yes. True.
Yes,
I
yeah,
think for
ma'am.
you it's like a dream come true. So it's a first
Yes,
step
ma'am.
towards your goal. So we
Yes,
are so
ma'am.
happy
Yeah.
for you.
Yeah, it's all
So
because of you and the lady expertise, ma'am.
thank you so much, dear. So tell us, tell us about yourself, your background. Where did you come from? I mean, like you've told that you finished M.Pharm in 2015 in India. So you're from India, isn't it?
Yes, ma'am, I'm
Yeah.
from India, and I came as a international student 2017, finished
Yeah.
my degree and everything. And always I was like, to be true, I started preparing in November for November last year.
Okay.
After preparing for 1 month, I just gave up, ma'am. Like I can't do it. But
So
when
you
I
were
heard
doing
about
it by
you,
yourself, is it?
yes, ma'am,
Yeah. Okay.
yeah. Then
Yeah.
I gave up. Like I can't do it because it's too much to study. Then I heard about you and Sir, then I was like, yeah, let's go for it. Then yeah, and you prepared it like the notes and the videos, ma'am. It helped a lot. Like yeah, the live lectures, ma'am. Like used to listen it twice because there was a big gap, like 8 years gap in my study. So somewhere I was like lacking. I would say lack of confidence too.
Yeah.
But like finally with your guidance, ma'am, I made it. Yeah.
So when you try to study alone, like the good thing about group study or coaching is you get a
Yes,
support
ma'am.
and you know
Yes,
where
ma'am.
to start, where to stop, and you know what to study and what not to study. The main thing is with such a big vast syllabus of caps, you should be knowing what you shouldn't be studying
That's right, ma'am.
rather than what you should be studying because there's so much junk which you don't need, which doesn't, I mean, like APC doesn't test you on. So if
Yeah.
you, it's kind of like streamlining your preparation and achieving your goal. So it's good. We've been of some use for you. So how did you? So you choose your CAPS pathway to become a pharmacist in Australia, isn't it?
Yes, ma'am. Yeah.
So how many months did you spend for CAPS preparation? Like for this exam,
For
how many
this
months?
exam,
Yes.
I started in end of March, ma'am.
Okay.
Like from end of like to 3 to 4 months. And initially I was giving 2 to 3 hours attending live lectures. And after that, I was listening the videos as well, like while working, like cooking in the kitchen and everything. And and yeah, that helped a lot. But last 2 months, I studied a lot, ma'am. Like I would say 14 to 16 hours. Yeah.
Huge.
Yeah.
So you were working
Yeah.
full time or part time?
Full time, ma'am.
Full
Full
time
time.
pharmacy technician is
Yeah.
not easy. There's a lot of
Yeah.
pressure on you. I mean, like work burden and all that, and we all know that. And on the top of it, you were giving this much time, so your hard work
Yes.
paid, I would say.
Yes, ma'am. Like last 2 weeks, I was working 3 days, but the days off, like 4 days off, I was studying like too much, ma'am. Like so much.
I know.
Because I wanted to clear in first attempt, because
Best.
everyone was saying it's like it's not possible, like you can't clear it in one go. Like it's like even the pharmacist which I work with, they say like, no, I cleared in my third attempt, I cleared in my fourth attempt, that's okay. But I didn't want to be the same, ma'am. I want to clear in first go.
And you made it, which is great.
Yes, ma'am, because of you. Yeah, thank you, ma'am.
So, what strategies did you have for preparation?
Okay, I used to attend live lectures, ma'am. So after that, I used to listen the recordings, and my concepts were clear, ma'am. Your examples, it made so easy. Like ANS, it was like big headache for me, but like examples you gave, I can like tell it straight away. Like it's easy, and even the sir CNS, like CNS, CVS, ma'am, it was like a big headache. But with your strategies, with your examples, my concepts were like so clear. And even in the exam, ma'am, like as you know, this exam was so hard, ma'am. Like it's
Yes.
yeah, the trend has changed. But when I saw them, ma'am, like the first paper one, I completed in 1 hour, ma'am.
Okay, so cool.
Yeah, and I checked 3 times, ma'am. All the answers. Yeah, ma'am, in the lectures you gave us the from your practical knowledge, as because you work in a pharmacy as a pharmacist. Yeah, the examples you gave from your own knowledge, ma'am, it came in exam direct questions.
Yeah. So yes, because APC expects you to have that practice-based knowledge. So
Yes,
hospital practice and community practice both are tested in the exam. So it's good to have that exposure into Australian practice, or to get guidance from someone who has that exposure, because that's what they test. Like they don't ask questions from Lippincott or any other standard books, but they want to apply. They want you to apply. Like if you were a pharmacist, how would you do this? How would you counsel for a cough medication? What would you recommend if a patient has blood pressure and a blocked nose? What would you not recommend? So they keep on testing all these, and they expect you to know. And that
yep, that
is
same
this
question I got in exam, the one you're telling, ma'am.
blocked nose.
Yeah, yeah.
Yeah, so yes, that's what they expect, because when you have to practice in Australia, they expect you to know Australian standards of practice, and yeah, that is what makes difference. Like
Yes,
yeah, and
yeah,
you
ma'am.
already have exposure, so that's great. So how did you tackle the paper two then? How was it?
Okay, I got 15 to 20 calculations, ma'am. Every 4 questions, there was a calculation. I was like, when it's gonna end, when it's gonna end. But, ma'am, like the calculation part, you explained so well, because some of the formulas I forgot, but I started from the back, ma'am, from the answers. Like I got the first
Yeah,
value. Yeah, because some of the formulas, like in my head, like it's gone. But some
yes,
of the calculations were new too, ma'am. But like with your like the way you explained it, yeah, it made so easy, ma'am.
yeah, and the therapeutics?
Therapeutics, ma'am. The revision classes we had at the end of 2 weeks classes, ma'am, it helped
Yes,
a lot.
yeah, yes.
Because
Therapeutics.
in the therapeutics, yeah, there was a like all the conditions, like combination of 2 diseases, and choose
Yeah,
the drugs to choose. Like it helped a lot, ma'am. The search classes and your classes, that especially the revision ones at the end, ma'am, it made so easy.
yes, all those important revision classes at the end makes a
Yeah.
lot of difference. Yes.
Yes, ma'am.
Yeah, true. Yes. Because when we are revising, we apply our knowledge in a better way, like more, because we've finished our concepts. Now, when we start revising, when we think about case scenarios, linking the concepts. So that's mean like when you start studying any subject, the subject has to go into your brain, and then it starts sitting and your brain gets matured. Then when you start applying, it shows result. So that's what
Yes,
happened
ma'am.
with you, I think. So
Yes,
that's
ma'am.
good. And yes, I think one last question. How strongly do you recommend Elite Expertise for your friends, and any special message for future aspirants who want
Oh
to
my God,
become
ma'am.
pharmacists?
Like as I said before, ma'am, like whenever I heard your name, Harika, and Arif sir's name, I was like, most of my friends say, like, go with them, go with them. Like they made it so easy for them. Like I have some friends, they come give their exam in March and November. They got like good results. Like I was like, yes, I'll try my best. But initially, I was not bit confused, like not confident. But you guys, like it's not about the study. When I feel low in confidence, I used to send message, ma'am, I think I can't. Like it's you were saying, no, you'll see, sit in the exam, then the question will hit in your brain, then you will
Yes,
be able
true.
to answer. That support, ma'am, and the encouragement I got from you guys, like it made my life easy, ma'am. Thank you so much. I would say, like, to everyone who is watching my video, please go for elite expertise. They are the experts in KAPS.
Thank you so much, dear. And yes, as you said, we feel like we are forgetting things when we are studying. And like even when we're practicing mocks, we feel like we're forgetting. But in the examination, when you sit on that chair, when you're like in
Yes,
front of computer, everything comes. Everything comes. You just have to trust your knowledge. So that's
yes, ma'am.
good. Thank you so much for recommending us, and thank you so much, Kanwa, for your time.
Thank you,
And
ma'am.
all the
Thank you
best for
to
your future endeavors. And I'm sure in 1 year's time from now, in less than 1 year's time from now, I would see you as a fully qualified pharmacist in Australia.
Thank you so much. Thank you, Arif sir, if you're listening this video. Thank you to Rekha. Thank you to Vikas. You all guys worked so hard. Thank you so much.
Thank you so much, dear. And from the team of Elite Expertise, a special big thank you for you for giving us an interview. Thank you.
Thank you, ma'am. Thank you.
Bye. Thank you, Kanwa.
Bye. Thank you.